Hi guys, this is Jerri.
And I'm Lauren.
And we're two drinks in.
So today we are going to have lots of conversations. But before we do that, we wanted to say thank you for everyone who tuned in to our podcast, our last episode where we talked with Mahalia. It was a very fun and interesting conversation. We talked about the creative industry and what it was like for all of us. So if you have not watched it, Go watch it now. And of course, you know what I'm going to say, smash that like button, press subscribe, and click on that notification bell. So today we have a special guest with us, and I'm going to let Jerri say the name because I always say it wrong.
So our guest today is actually our shared GP.
Our shared GP, yep.
And also Shian's GP now.
Yes.
Her name is Dr. Danielle Reid-Melillo.
And what's funny about that is, believe it or not, like we all came to Dr. Danielle. That's what I call her, because as y'all heard, the whole name is a tongue twister for me. But Dr. Danielle, we came to Dr. Danielle on our own accord.
Yeah, all separately.
Mm-hmm. And then one day I was probably trying to sell them on Dr. Danielle, and Jerri was like, "Oh, but she's my doctor too." How did I meet Dr. Danielle? I think what it was during the pandemic for sure. And I was having some really severe acid reflux. It's got real bad acid reflux, guys. I know. And because it was in the pandemic, of course, we weren't able to go to the doctor the way you would usually go. All right. And to be honest, I haven't had a GP in a while, because, at UWE, you have the UWE clinic. And it was that kind of funny stage for me where it was like you're moving into independence. You need to find like somebody who you trust that you can go to.
Yeah.
And this was my first like period where I needed, somebody. And of course, so back to we're in the pandemic and I having real bad acid reflux. Like I was feeling nauseous. I was feeling dizzy. And we're going to start talking about our medical history now. Because I don't want y'all going out there and Googling and diagnosing yourselves like I do.
Like she does all the time.
But yeah, I needed somebody, and I picked up the phone, and I remember, because we live very close to where her office is. And I was like, I'm going to call her and I'm going to see. Well, at the point, I didn't know it was her. I'm going to call the doctor's office and I'm going to see, because I was in crisis if I could come. And literally, it was amazing, because at the time in which I called Dr. Danielle, she literally sat down on the phone and she talked to me and she found out how I was feeling. And I think she scheduled in the appointment the next day. And it was really amazing to have that level of accessibility, especially in these times, because, you're calling doctors, you're trying to get through, you're speaking to a receptionist. And not that that's bad or anything, but sometimes, and in the state I was, it was really nice to be able to physically reach out and meet her without it feeling like uncomfortable or me being a millennial and scared to, set appointments and stuff like that. But yeah, and our relationship grew from there. So yeah, that was me. What was your meet cute with Dr. Danielle? How did how did she become your doctor?
Well, she actually became our doctor because of Amory. Amory had an ear infection. And when we got there at the clinic, I think that was the first time, obviously, us meeting her. And I immediately wanted to switch over to Dr. Danielle because I felt so comfortable. And like you were saying, she's so accessible. I was able to send her messages over like WhatsApp and ask any questions that I needed.
Exactly.
And then when we eventually wanted to switch birth control, she had all the information ready. So it felt like an easy transition.
Yeah. And that to me too was the thing about it, because here, confession for the soul time. Lauren, the self-diagnose.
Oh God.
So it was really nice to have somebody that I could be like, I'm freaking out, Dr. Danielle. Am I going to die? And she would just be like, no, Lauren, you're okay. You can come and see me, XYZ time. And at least, you have that person that you can reach out to. And I'm not saying to go message Dr. Danielle 24 hours a day. I just want to put that out there.
Don't be another Lauren.
But it's really nice to at least have somebody who is willing to be like, you're okay. Calm down. We will check on this at our next visit.
Yeah.
You know?
That's why I was so glad that you found her.
It was amazing, you know? And I think we have introduced Chian. I think I can officially say this on Chian's behalf, that she is now Chian's doctor too.
She will be switching over as well.
Yes. But yeah, it was just a really good thing. And I went and got my first pap smear, guys. Yay! Yeah, long overdue. If you've reached my age and you haven't had your pap smear, go get it done.
Please do.
But while we were there, we were talking about testing and screening, you know, and just sexual and vaginal health and stuff like that for women in particular, because I'm a woman, but also for men. And we were just discussing how it is still important for us. And what do you call it? LTMMR?
Yes, LTMMR. That's a long-term mutually monogamous relationship.
Yeah, so even for us who are in LTMMRs, I'm gonna probably say that once, like wrong one these times, but you know what I mean. To still, you know, make sure that we are
getting checked,
you know.
When is the last time you've been tested?
And that's the interesting thing. Not since Russell, and we've been together for like 7 years.
Me either. I think when we first started dating, and not since then.
We would have done that big jump in together.
Yeah.
Where it was like we're both getting tested together and we are doing, but not since then, you know. And after our conversation, we would have been talking about it, and I'm gonna hand it over to you so you can just give us a little, you know, a little overview about why it's so important to get tested, even as somebody who is particularly being safe, you know. But it's still good to know. It's still good to know your status and to get tested. And I think that was kind of like the starting point of our conversation, which is how we ended up here today. So you can start by introducing yourself, I think. I think you can give yourself a little bit of a who you are and what you do and stuff like that.
Yeah, like real,
and we can go
like a real short
Like
cut.
a real short, yeah.
Okay, so I was already introduced, but just in case you didn't catch my name, I'm Dr. Danielle Reid-Melillo.
I love your name, by the way.
Thank you. You can thank my husband. So I'm a GP, which is a general practitioner. Basically, general practitioners see everyone. So we see from kids to middle-aged to older people. We practically see whatever comes into the office. So we have to know a little bit of everything, which makes it challenging but exciting. That's actually why I like being a GP.
Okay.
For me personally, I'm very passionate about preventing disease. So disease prevention. So what we use as a tool to prevent disease are screening tests. So, you know, as you said about the pap smear, that is a screening test for cervical cancer. There's also, you know, the PSA that the guys would do. That's the prostate specific antigen for prostate cancer. And then there's my favorite, STD screening. This is for sexually transmitted diseases.
So in terms of how you operate, do you find, like, was that a choice you made to be so accessible to like our millennial group so that we feel more like, was that because it isn't quite conventional, you know, and I mean, who might say what conventional is, but based on my experience of going to doctors growing up, I never had a doctor who was so open, and I don't want to say that you're really accessible, but because but you are, you know, you really are, you really are, and in a way that makes you comfortable to kind of reach out and chat to you. Was that a choice you made when you were setting up?
Yes, pretty much in terms of privacy. So I wanted you to be speaking directly to me. At times it could be a little bit overwhelming, but I think I have it pretty much handled. You know, technology makes it much easier.
Yeah.
And also, you know, just, you know, like in terms of discrimination, you know, I would see a lot of different groups, like persons from the LGBTQ plus community. I see everyone, just as a heads up. So it's not only persons from that community, but just to let people feel a little bit more comfortable. I could also get to the gist of the visit a bit quicker so I could triage. So I would triage. I also set my own appointment so I know exactly, you know, if I might run over. So it just goes more smoothly. So it's really just to be smooth for the clients and for myself, you know, because so I can have a life too. It's just better for everybody. And for safety and, you know, it just runs a bit smoother that way.
Okay.
It also is good now for COVID because, you know, I don't have a crowded place and, you know, it's less anxiety about COVID for me and for my patients.
That is true. I don't think I've ever seen anybody in your waiting area.
Yeah, whenever you get there, it's just you.
Yeah.
Yeah.
And I know that you have persons after me because, you know, I'm a chatterbox. I was being there talking off Dr. Danielle ear.
She told me that you put her out the other day.
After an hour and a half of the appointment, okay, guys? Like, I just want to put that out there. That we had finished and we were at that point literally just chatting.
Yeah.
You know?
I was waiting on my next client. So I didn't really kick out Lauren. She was keeping my company for a little bit.
I was not surprised. Is all I will say.
But yeah, I'm definitely a chatterbox, and it's really nice to be comfortable. And I think, and I mean, I can't really speak from experience here because, as we said, like, it's been 7 years since we've been tested. But I'm assuming that it would make it easier for persons to come to you to be tested because they're more comfortable. Like, do you find that your business model helps with the level of comfort in persons testing? Like the fact that people can come and just speak to you without having to go through.
Yes, it does. But I don't think it's much more the business model, but just how, you know, how easily the interaction flows, like when I'm dealing directly with the patient. And, you know, I just listen to what you have to say. And it's absolutely no judgment.
I think that goes down to your bedside manner. I will say, of all the doctors I've gone to, you are up there. So if there's anyone that I'm going to call, it is definitely you. I called you with an eye problem the other day.
Yes.
When we were figuring out if I should go to the doctor. And I was like, well, Amory, Dr. Danielle told me that we need to go and get my eye checked. So we need to go down and we need to go to the eye doctor. And thank God, because the thing actually caused an allergic reaction. So they had to give me antibiotics. But yeah, you're the first person that we call when we have a problem. And I really, really like how you deal with your patients.
Yeah.
Thank you. I try my best.
Y'all could tell that we really love Dr. Danielle. We've just been singing her praises, you know? Well, okay, Dr. Danielle. So when last we spoke, you would have said that you wanted to come and talk to us about STDs and STD testing. So why is it so important to test?
Okay, so the reason I am so passionate about STD testing is that everyone has sex, right? And STDs are sexually transmitted diseases. And we have pandemics going on, you know, like HIV, you know, that's a pandemic. We're not talking a lot about it now, but, you know, it's out there, you know, gonorrhea, syphilis, chlamydia. So it's important because sex is a part of our lives. No one really talks much about it, but it's important. So the STDs we're going to talk about today, I decided to just split them in two categories. So we have bacterial and we have viral. The bacterial ones are curable and the viral ones, you know, they're treatable. So for every STD test, we have a treatment for that, right? In general, doctors can treat you. So I know there's an air of apprehension about getting tested, but it's something you should do because most of them are curable and the others can be treated. Now, for the bacterial test, those would be for chlamydia, gonorrhea, and syphilis. Good. So we can start with chlamydia and gonorrhea. So the reason why I mentioned both of them together, you know, usually when you see one, you see the other one. So you kind of have to look for it. And both of them, they're transmitted via vaginal, anal, and oral sexual contact. So the basis for all of the STD testing, I always tell people the only absolute way to not get an STD is to be abstinent. Now, that is not realistic. You know, everyone isn't going to be abstinent. So testing before sexual intercourse or sexual contact is the best way to go.
Okay.
Also using protection, like you can use condoms. If you're going to use condoms, you need to use them correctly
Can I
every
ask a
time.
question?
Yes, sure.
Okay. So for people that can't use condoms,
Such as?
well, if you have an allergy,
So there's always an alternative. So if you have an allergy, there's non-latex condoms.
I've tried those and I did not like them.
Oh, you did? You did not like them. Why didn't you like them?
I'm hoping he cuts this out. For me, I found that they made me really, really dry.
Oh, okay.
Like nothing that I've seen from my body before. So they weren't an option for me.
Well, it might just be the brand, and then there's always lubricant. The thing is, if you're in so this is where LTMMR comes in,
Come into play. Okay.
which is a long-term mutually monogamous, emphasis on mutually
yeah.
relationship.
Mutually.
So if you both get tested, you're both negative, you both talk to each other and agree you're going to only have sexual intercourse or
With
sexual
each other.
contact with each
Yeah.
other. Obviously, there's a factor of trust in there. So once you can trust each other and you do that, you generally should be good once you don't have any contact. Yeah. So in that case, you can maybe do that first and you can leave out the condoms. But the safest way is to use some sort of barrier, right? The most common barrier here we have will be the male condoms or the female condoms. And talking about condoms, most of my male patients that, you know, might tell me that they don't like to wear condoms. You know, it might be the size. So for the guys out there, you should try different sizes, you know, different lengths, widths, to make sure you're comfortable, because every condom is not the same.
Yeah, get the gold pack, guys.
I just try different sizes. In terms of, I just wanted to circle back because we're talking about gonorrhea and chlamydia. But what are the symptoms? Like, when should you get tested for, like, you know?
No, what is interesting is chlamydia and gonorrhea. Sometimes you might be what we call asymptomatic. You might not have any symptoms. So that's why it's important to get tested, because you might have a really old infection that was never detected. You never had any symptoms and it wasn't treated. And then you can pass it on to a new partner.
Oh, wow.
Yeah.
That's crazy.
So now, like for the females, if you get, you know, symptoms, you might have a discharge, you might have burning on urination. For the guys, you might have same discharge, burn on your urination. Sometimes it can go all the way down to the testes and cause what we call epididymitis. It's a really big word, but basically your testicles hurt. I can say testicles, right?
Yeah.
Yeah. So just so you will understand, you know, the symptoms. But that doesn't always happen. Most of the time it's asymptomatic. So I would have, you know, patients that I test, and then when the results come back positive, they're surprised because nothing is going on. But, you know, it's curable. That is the take home. You know, you just get tested, you get the treatment, and, you know, you tell your partner. I always advocate for you to tell your partner, because even if something happened, your partner was unfaithful, you need to think about the next person that your partner is going to go with. Okay, so because we want to stop the spread, right? What's important to stop the spread is to get tested, get treated, and then you're going to get tested before you go into a new relationship.
Okay.
In terms of when you get tested, a question that I was talking to Chian about was when you send the test results, because, for example, some of the tests, like, for example, HIV, you wouldn't necessarily want the person, like, you wouldn't want their full name on the results, because everybody who, well, I'm not sure I'm asking, who would see who's part of the testing process outside of you, because obviously there's that mutual trust between us, but outside of your office. So do you like code it? Do you code the...
Okay, so the HIV tests are coded. right? They're always coded. So if I'm doing a rapid test, well, obviously that will be in the office. It's just me and you. If that, unfortunately happens to come out positive, then we do another confirmatory test, and that is coded for sure. You also have the option, like let's say it was to send any of the tests to the lab, I can code any test. The lab will still process it.
Okay.
Right? These are for the tests that I don't do in the office. So you still have that option. Even for regular tests, I can code anything.
Okay.
Just once, obviously I would document the code, and I will be able to match back my records to say, okay, these are your results. But the lab is used to that. So that's totally fine.
So at least you would know for sure that when you go to get tested, you don't have to worry about, because you never know. Barbados is really small. You don't know who you know in the lab. And I know for some people, that's part of the fear, because you don't really want people knowing your business. Yeah.
Well, the thing is, we're all medical professionals. The lab is very professional. So for us, I guess for the lab, it's just a result. They're just doing the test.
Just another day
and
at
they're
work.
giving it back to me, So the whole process is very professional.
Yeah.
So you won't have to worry about, your business getting out there, because, we have a code of ethics. You're supposed to be confidential, with results, and just, do what we're supposed to do, and in order to get you better.
Okay. If I was tested now and I found out that I had chlamydia or gonorrhea, what's the treatment like? What do I do?
Okay, so the treatment is actually pretty easy for the gonorrhea. It's a same day treatment. The only thing is the treatment is in office. Is actually a shot that we give. So I would need to treat your partner also. For the chlamydia, well, before there was just a 1 day treatment, but now the guidelines actually changed recently, so you'll be taking medication for a week.
Okay.
And it's pretty simple. You would take the medication, your partner would take the medication. I usually would write a prescription, to make it, I guess, less awkward, because some people might not want to come in because of embarrassment.
Yeah.
So I would write the prescription if that person does not want to come in person. And it's really simple. So what you do after treatment, I would advise, not have any intercourse or any sexual contact for 7 days. Obviously, if you're both on treatment, you might think, okay, it should be okay that, we can do stuff. But no, you're not going to have any contact at all. No intercourse for 7 days. And then you should be fine. So as a reminder, even though you're treated for an STD once, you can still get it again. So the chlamydia and gonorrhea, even though you've had it and we've treated it, you can still be reinfected with it. Okay? Because remember, it's a bacteria. It's not a virus we're dealing with.
Sorry. Do you actually see a lot of cases of like people getting them again?
Yes, I do.
Okay.
Is it worse the second time?
Not really. I mean, the symptoms are pretty much the same, or they might be asymptomatic. So just remember that's a factor. So you might not even get symptoms. So that's why it's important to practice safe sexual practices. If you're not going to be LT-MMR, because everyone doesn't want to be in a relationship.
And that's okay.
Yeah, that's totally fine. Just once you get your partner tested, you get tested and you use protection. It's not the amount of times you have intercourse, it's how safely you have intercourse. That's important.
I like that. It's not the amount of times you have intercourse, but how safely you have intercourse. I like that. So we talked about chlamydia, we talked about gonorrhea, but how about syphilis? Like, that's one that, you hear, but, what's the deal with that? What are the symptoms? And
okay, so syphilis is also a bacterial infection, and it is treatable, curable, actually. So that's a good thing. The only thing is about syphilis is very strange, because you will have symptoms, but then even if you treat it or not, the symptoms go away. And then it goes on to a different stage. So syphilis have different stages. So there's the primary stage.
Okay, what does the primary stage look like?
So the primary stage, it starts off with a chancre, which is the syphilis sore. What's interesting about the sore is that it's painless. It's not a painful sore. So unless you feel it or see it, you might miss it.
Wow.
You know, so, and also, even if it's not treated, the sore goes away. Yeah. So that is what makes syphilis a little bit more tricky. You need to get tested because you might miss it, because we might pick it up in another phase. So the primary phase, you get the chancre, it goes away. Then afterwards, for the secondary stage, you can have a generalized rash. So, you know, not all rashes are mosquito bites, or you need to make sure that is not missed, because it could be missed, because that goes away too, even if you're treated or not. Now, during this whole time, you're contagious, you're infectious. So you can pass it on easily, right? You can pass it on at any stage once you're not treated.
Okay.
Now, after that secondary stage, you have the latent phase that could go on for years, you know, and you could feel normal. And then the tertiary stage, no, that one is a bit more serious, because it can affect multiple organ systems. After a prolonged period of time, you can even get dementia.
So that was my question. Because the only time I've ever seen, well, not the only time, but the most time I say anything about syphilis is when I'm watching like a period movie and somebody goes crazy when they catch it. So is that something that really actually happens?
Yes,
still happens now?
Yes, you can have dementia. I've seen through my medical career, because I've worked different places, not only in Barbados, but I've seen dementia in hospitals that was caused by syphilis, because we do something called dementia screening. There's a whole bunch of tests we run, because a lot of things can cause a dementia, like, you know, illness.
That's so scary.
Yeah, well, it's not, it would sound scary, but it's treatable.
Okay.
So even at that stage, it's treatable, but regrettably, whatever damage is done is irreversible. So that's why we ask patients to get tested, you know, go to your doctor, get tested. So whichever phase we find you, we could treat you, and hopefully so that no more damage is done. Because as I said, the damage is irreversible.
Okay.
Now, talking about damage, just going back to chlamydia and gonorrhea, also, if those are left untreated, you can have something called pelvic inflammatory disease, which could lead to infertility. So that's why it's important to get tested, not only for your partner, but for you. You know, think of it as self-care.
Okay.
You know, you should at least if you're sexually active and you're single, you know, or even if you're in an LTMMR, you know, you could at least try to get tested every year.
So what are your recommendations for people that might be in an open relationship?
Okay, so open relationship is pretty easy for them. They just have to test their partners and use protection. Pretty much. That reduces the chances. There's no, the only absolute is abstinence, as I said before. And that is not really that common, you know, because we're trying to be realistic here. Yeah, it's not really common. So you just need to get tested, get your partner tested. You know, there's rapid testing, you know, you can get them tested the same day. So there's really no excuse.
Yeah, and have conversations with each other, guys. Please.
Guys, I'm not sure if y'all watch me sit down, eat I'm picking out the raisins, because this is a lot. But I think it's just as simple as just making sure you're on top of things. Just schedule your, how often do you say your schedule? Because I'm about to tell people to schedule their tests yearly, but it might be, you know, beneficial to do it more often. Like, how often should we get tested?
Well, it really depends on your situation. Ideally, for everyone, I would like you to get tested at least once a year. So we have some special groups. So the special groups would be, you know, like people that may exchange sex for different items. So like sex for money or sex for things. You know, if you're having those type of transactions that might be often, you should maybe think about getting tested sooner. So maybe like every 3 months. at least every 3 months, every 6 months.
So now that we're talking about testing, I know there's been a common misconception that LGBTQ plus people are more susceptible to certain things. What do you have to say about that? And in terms of, is it true? Do you find that is something that you see a lot in terms of people thinking that way within that community?
Well, I would say in general, once you have sex, you're at risk for having an STD. Now, some studies have shown that the anal route is a bit more risky than the vaginal route. But no, even if you're in the LGBTQ community or not, lots of people are having both vaginal and anal sex that might be straight, right? So it really comes down to knowing how much exposure you have. So even if you're not in an LTMMR, that's a long-term mutually monogamous relationship, you need to get tested more often. So if it's with your boyfriend, if it's with your girlfriend, if it's sometimes with your boyfriend and girlfriend, you all need to be getting tested and you need to be using protection. But if you're single and you have multiple partners, be it if you're in the LGBTQ community or not, I would say it will be best to do every 3 to 6 months. So you can budget it. You can say, okay, well, I'm going to do this every 3 months, or I'm going to do this every 6 months, but at least do it every year. So it depends. So, and I would put everybody under the same umbrella. Actually, from my experience, most of my LGBTQ plus clients actually get tested way more often. So they're actually pretty strict with testing, which I love. And I would like that for everybody. Because as I said, once you have intercourse, you're at risk.
Yeah. It's sounding more and more like we need to get ourselves tested, Jerri. Like, I know we're in LTMMRs, but better safe than sorry, Always.
It better be safe.
I mean, that's a good way to pick up, right? Because I cannot imagine. You imagine our conversation when you get home?
Conversation? That's not going to be a conversation.
Babe, I just found out that I have XYZ. How did I get XYZ? Because when we started this relationship,
exactly.
I didn't have XYZ. How do you, because of course you see it more than us, right? And I can't imagine how I would deal finding out, because I think I would lose my LTMMR. But how do you suggest? Because of course there would be people who find themselves in these situations.
Yes.
And you really don't know. Like, we like to think that we know. We like to swear for people, but we really don't know.
No, I think some people know. Would you say that sometimes people might have an idea that there's something going on, but then they don't feel like they should go and get checked?
Yes, I actually do see that, especially with married couples, because sometimes I do get, you could get married couples that might have, STDs. So my take on it is just to be honest, right? Be honest, talk about it, get tested, and go from there. Because from my end, it's just about you being safe. My most important thing is for you to be tested, treated, and healthy. Now, the other stuff, you can deal with counseling and everything for the moral relationship side of it. But for me, I want you to be safe.
Yeah.
So moral of the story, guys, just be honest.
And get tested. And don't swear for nobody. Always get tested. I was saying I can't remember who it was I was talking to. Was it you, Jerri? But I was talking to somebody, and I was saying that part of it boils down to me to self-love and to loving yourself and, caring for yourself for all the tasks that you do, that you think about doing. It's kind of always about making sure that you as a person are in a good place, that you're healthy, that you're protecting yourself, that you are being safe for you. You can't do it for anybody else but you.
It's true.
And you only got one body, and if you can do it for somebody, you could as well be doing it for yourself.
Yeah.
So
I was actually embarrassed when I saw the topic because I was like, I don't remember the last time that I've even thought about
testing.
Yeah.
Me either. But I think just to say that we're gonna do it, I'm gonna do it. I'm gonna go get tested.
We should go together.
Yes, let's do it. Let's do just like, is it just like a general screen? Like, what do you call when you just test for everything?
We could just do a general screening.
Just general screening.
Yes.
Because you never know. And I think you were saying before, like sometimes things can things go undetected and then you find out. So maybe you think that you're healthy.
Yeah.
And then because you're not having symptoms and stuff like that.
Yeah, you might not know.
Right. And then you come and you find out. So it's not necessarily that you're meaning to be any way towards somebody. It's not that you're meaning to pass on these diseases. It's just that you don't know because you haven't done the testing.
Yes, exactly. So that's why I tell patients, like, before you enter into a relationship, just get tested.
Yeah.
So if someone has chlamydia, the other person has syphilis, we can get treated. You could clean the slate, say, okay, if this is from the past, we're good now. We're in a LTMMR and we can have all the fun that we want. We can get tested every year. We stay committed. And, that's how we would like things to be.
You know how you have BFFs? I want like a little thing that says LTMMR. So instead of BFF, I want LTMMR on my chain.
Yes, if you don't remember anything from this talk, LTMMR. That is the most important takeaway message.
Yes, long-term mutually monogamous relationship.
Yes,
and the mutual part is very, very
mutually
with protection.
With protection. So we were just talking about some bacterial infections for sure, but when you introduced it, I remember you was talking about viral infections and stuff like that. So in terms of the viral infections, what are we talking about?
Yeah, so for the viral infections, I thought it would be good to talk about herpes and HIV. First, we could talk about herpes.
Okay.
So herpes, it's herpes simplex virus. There's two types. There's type 1 and type 2. So traditionally, the type 1 is the oral type. Okay. So you get that around the mouth and the face. And the type 2 is the genital one. So you can get it, on the penis and the vagina. And now not really now, more than likely this was going on from before, but with oral intercourse, it can be interchangeable.
I was about to ask that question. I was literally about to ask what happens if you had an oral outbreak, and it's because we just talked about that being simplex 1, and then you were, engaging in oral sex, like, does it then become type 2? Like, is it like that?
So it's still the same virus. It's just, it might be in a different place.
Oh, okay.
So if you have, like, let's say as an example, you have oral intercourse or someone has oral intercourse with a male that has genital, type 2 herpes virus, and they have an outbreak and, they're having sex in the dark and they didn't really look, and the next morning they wake up with an outbreak, more than likely it will be type 2. But you would only know if you get tested to know which type, but usually it's, a cold sore, that would be type 1. And then, you have the genital outbreak. So I see a lot of people that would just come for the screening. You might just have one outbreak maybe like 5 years ago and you never have an outbreak after that.
Okay. And
then when you get the test done, it shows up as positive, and then you're wondering how did this happen? But of course, if you didn't get tested before your relationship, you can't blame your partner because it could have been something that was dormant, because it lays dormant. Stress would bring it out. Exams, if you're worried about something, even with with COVID, we're dealing with stress all around right now. So you're going to see a lot more outbreaks.
Oof. So how would we spot the difference between a cold sore and just like an actual outbreak? Is there a difference?
Okay, so usually the herpes viruses, they would come out as what we call a vesicle. So it's kind of like a water bump. So you might have like just one water bump. This is for type 1.
Okay.
Right? The oral one. You might have one water bump, like maybe somewhere around the this area of the face, around the mouth and the nose, or it might be a cluster. Usually it would be painful, so we already spotted a difference with the syphilis that was painless. So this one is painful. Then it evolves, so it might burst and then it will crust over and then it goes away. Now, the same can happen in the genital area. So, you might think, okay, this might be like a hair bump. It might feel like that, like how that might hurt,
Okay.
So, if you see, the point is, if you see something that's out of the ordinary, you just go to your doctor and you get it checked out.
Yeah.
Yeah. So you know what it is. Now, the herpes virus, remember, is a virus. So it's not curable, but it's treatable and it's extremely treatable. So if you're a positive for herpes, there's treatment. There's a lot of stigma surrounding herpes. I think mainly because, it's something that you would have for life, but it's very treatable and you might not have outbreaks often. And even if you do have often outbreaks, there's something called suppressive therapy. So we can put you on that so that, your partner wouldn't be exposed as easily. Right? So you can still have a normal life if you have genital herpes. It will not stop you from being fertile. It will not stop you from getting married or having kids. You can do all of that like anybody else without herpes. Right? The most important thing is to be treated. When you have an outbreak is when you're infectious. Right? There's still a very small chance that you can spread the herpes without an outbreak, but it is really slim.
Okay.
Right? So once you don't have an outbreak, you can have sex. When you have an outbreak, you spot it, you say, oh my gosh, I need to take my meds. You take your meds. Usually after like 3 days, you're good to go again. So it's nothing to not minimizing how someone might feel if they have herpes, but it is something that you can live with very easily.
And you can have a normal life with it. So not only live, but have a regular life.
Normal, regular life.
Yeah.
What a lot of females would ask me about is what happens, like when I'm pregnant. So if you have an outbreak when you're about to give birth, you would have a cesarean section, just so that the baby would not get herpes at that point, because the babies don't really have much of an immune system to begin with, right? Herpes infection can be very dangerous in neonates. Yeah, so that's really the only difference. And we check everybody, so it's not like this is something especially for you. You're gonna look where the baby's coming out. Like everybody gets checked because maybe what if you never had a herpes test? You're not gonna know unless you get tested.
Yeah,
You may never know.
Exactly. So and one other thing, what I mainly get asked about is, okay, so what if I'm gonna start a new relationship? How do I tell this other person that I have herpes?
That's a big one.
So I usually would advise the patient to go with their partner and get tested, include type 1 and type 2 herpes in the test if you're generally worried about that, because your partner might have herpes also. And that might break the ice a little bit easier. But I also offer, if they do the test and it's negative and, my patient's so worried, I can talk to you. I can counsel you. I'm sure your doctor would do that also to make it just a little more easier, because you can have a normal life. It's nothing to stop living your life over. You're still going to be beautiful. You're not dirty. Is not something that you should stop living for.
Yeah. And I think that's the one thing that a lot of people don't understand. And I say a lot of people, but me for sure. Because I remember when I was at university and I was like, we not getting the herpes. and be not getting AIDS. Like those were the two things that were the stopping grounds. I couldn't imagine how I would feel because I put those two things on such a huge pedestal.
Yeah.
You know, if I had found out, and I used to test for those two things. I didn't really care about all the rest, which is very irresponsible to say, but it's the truth.
But you know better now.
Right? I do. I know better now. Yes, we're testing for all. But those were the two things. And I think now with a lot more education and a lot more, you know, visibility and conversation around it, it's good to hear that you can have herpes and you can just make sure you're treating yourself and you're taking care of yourself and that you can live a normal life.
Yeah.
You know?
And that it's not going to stop you from having kids in
Having
the future.
kids or, you know, doing any of the major milestones that we all look forward to because, you know, we all do. So it's good to hear.
What's also important to mention, most adults have type 1 herpes, which is the one that causes the cold sores, is extremely common.
Yeah.
So what I wanted to mention also is that there's a reason why, well, let's put it this way. A lot of people wouldn't really recommend the herpes testing because it doesn't really affect your body in a way that would harm you. But because of the social stigma, especially with what I see, you know, it's very traumatic. A diagnosis of herpes can be very traumatic, especially for women. So I would advise, you know, to get tested before you get into a relationship, or just get tested for yourself, you know, so that you know and you can educate yourself more about it. But it's not something that would stop you from having a healthy life or not being able to reproduce. Like, you would still be able to do all those things, but you should get tested if it is something that is important to you.
So takeaways, you can have herpes and still live a very full and prosperous and happy life.
Yes.
Takeaway. I like that. I feel like my little qualms and because as I was saying, I was real high strung when it came to herpes, especially as a younger child.
I'm high strung about any STDs or STIs, to be honest. Like anything where below the belt where I need to go to the doctor, I immediately go to what if I caught something?
Yeah. No, I think for me it was, as I keep saying it was herpes and HIV. It was those two things, and I'm not sure if it was because of, well, herpes. It was the TV thing, you know, like how you would always hear about herpes. You always hear about people who, you know, they had a sore and you passed it on, you know, from, you know, sharing different things. And because I didn't have a clear understanding, like, of course now, and especially with this talk, I'm getting more educated about it and having a better understanding. But back then, you know, it wasn't like STIs weren't something like you hear about them and you would see all the information about it presented in a certain way. But it wasn't like something that we had open and honest conversations about. So I'm very happy that we did this. But for me, it was herpes and HIV.
Yeah, so HIV is still out there. It's a good thing that there is World AIDS Day because it kind of clicks for people. Oh, wait, did I get my test? Did I get an HIV test?
Haven't been tested in a while.
Yeah, so usually around that time is when I would have most patients come and say, you know, I need to get a test. You know, this is around my time to go and get tested. And HIV is something you can live with, right? You can still live with HIV. It's not a death sentence. We've even gotten the treatment down to 1 pill a day, you know. There are different regimens. And we're extremely lucky to live in a country that we can have free, you know, HIV treatment for citizens. We're extremely lucky to have that because in some other countries it's really expensive. Like, can you imagine spending $300 US a month, you know, to get your pills?
It's crazy.
Yeah, so we're blessed. We are blessed that we can have free treatment. You can have free testing too. Then if you're not into the free testing and you could be tested in a in a non-judgmental, confidential environment.
With
so
a
you
Dr.
have,
Danielle.
or with your doctor.
Or with your doctor.
But you can get tested. That's the point. You can get tested, and there's treatment. There's actually, hopefully soon, going to be treatment that you can just get a shot every 6 months. So imagine how great that would be.
Yeah.
Of course, for me, my thing is about prevention. So I don't want you to have to get there. It's easier to prevent something than to treat it.
Yeah.
So for HIV, you can get it from, intercourse, as we said before, vaginal, anal, oral. Basically once the infected body fluids come into contact with the mucous membranes, there's a chance of getting HIV. So for the prevention, we actually have something called PrEP. That is pre-exposure prophylaxis. So it's a pill that you can take every day to prevent you from getting HIV. Now, that is if you want to take that approach, right? So some of the special groups or people that, want to be extra careful, you can do that. Or as I said before, for every STD, you get tested before you get into a relationship. Ideally, you will want to be in an LT-MMR, or if you're single, just get tested. Get tested. Let the person get tested. You get tested, and think about yourself. Like if someone would not get tested for you, how much do they really care about you?
Yeah.
Think about it that way.
Self-love.
Yeah, you need to love yourself. If you can get tested for somebody, that person can get tested for you. And if you're not okay with it, then don't have sex with them.
Yep.
Right? The take home is to get tested.
So can we circle back a little bit to PrEP? Because it was something, and I ain't gonna lie, of course I would have heard about PrEP in certain circles. But I actually saw it being advertised on GIS Barbados. And I don't want to say advertised, but they were literally just talking about PrEP. Is it something that everybody can take? PrEP?
Well, as with any medication, there will be what we call some contraindications. But that is something that you could discuss with your doctor. Yeah, and you can, once it's okay for you to take it, then you can take it. But it's generally available for everybody.
Okay.
But obviously, if you have like liver failure or something, you might not be able to take it. But generally, for a healthy person, it's fine to take.
Okay. And it's not necessarily for certain like groups of people. Say, for example, I was in an open relationship and I wanted to have, or I was not in a relationship and was somebody who was having sex without a condom, so unprotected sex. I would be one of those people who would be thinking, okay, well, maybe I should take PrEP. Is that correct?
So PrEP is pre-exposure. So this is before you're exposed to HIV. So of course, patients that already have HIV, you're not going to be taking PrEP, but your partner can take PrEP, or someone who doesn't have HIV, you'll take PrEP, right? But you're not going to take it. For after, we have something called the post-exposure treatment, which is different from the PrEP, because remember, we're dealing with prevention right now.
Yeah.
Right. Afterwards, we can deal with that part too. Like if you have a known contact that you were exposed to, your doctor can treat you for that too.
But in terms of like my sexual history, so I don't have AIDS and I want to have sex. I'm one of those people who know that I have unprotected sex. I'm not speaking about me particularly, guys, because I'm in an LT-MMR.
Yes, as an example.
But as an example, like, is it for, like, I'm trying to figure out, because I don't want to, and don't ball me out, but every time I've heard about PrEP, and I know it's a thing, a misconception, but I think about that certain grouping of people, So, for example, people who have sex for different reasons, for different exchanges and stuff like that.
PrEP is for everyone.
But it's for everyone. That's what I was trying to ask. Like, can just a regular person who is...
PrEP is for everyone. Once it's medically okay for you to take it, it's for everyone.
Okay.
So it's not only for particular groups or people who may have... Well, obviously, if you have more exposure, it'll be great if you're taking PrEP. But anyone can take it.
Anyone can take it.
So it's not for a particular person. It's for everyone.
It's for everyone. Okay.
I definitely did think when you mentioned it was immediately circle back to when we were talking about sex workers, because it was like that would be a good way to protect yourself, though.
But that's what I was saying. Like whenever I think of PrEP, I that's the you know, and it's that's why I was trying to get the vote saying that I'm bigoted or biased, right?
I don't think it's bigoted.
But that's where I thought about it. But realistically, if we're having open or you're just sexually free, right? Sexually free relationship. Say that's what you've chosen for yourself.
Yeah.
PrEP might be a good option for you, you know, because like obviously always use a condom. They always practice safe sex, but there can be some people who can be like, nah,
and that's not information that they might necessarily already have. Yeah.
Because I didn't know, and I knew about PrEP, but I thought it was for specific people. I didn't think that anybody could take PrEP. You know what I mean?
I feel like PrEP here is, well, worldwide. It's targeted, you know, for the LGBTQ community or persons who exchange sex for goods. But it should really be for everyone, for whoever has sex. It's for everyone. Anyone can get HIV. It does not discriminate.
It does not.
You can be a virgin and have intercourse and get HIV. It has no boundaries. You can have sex 1,000 times a week or one time and you can still catch HIV. So at the end of the day, it's always about getting tested, protecting yourself. That is the most important thing. And PrEP is one other step that you can take if you're interested in that.
Okay. So I noticed within myself that even when I'm speaking about it, so sometimes I want to say, I use the term AIDS, and I have to correct myself and say HIV because I know there's a difference. But what actually is the difference between the two things, HIV and AIDS?
So first, the HIV, it stands for human immunodeficiency virus, and AIDS is acquired immunodeficiency syndrome. So the virus, after a while, causes the syndrome. So basically what the HIV does, in basic terms, it attacks your immune system until effectively your immune system is very, very weak. And then that allows what we call opportunistic infections. It's a really big word, but basically is really infections that if your immune system is functioning, we wouldn't generally see. So that is, that signals to us, okay, well, we might be in AIDS territory. Of course, we have testing for that. Because once you have HIV, then we monitor you. We monitor your cell count. We monitor the viral load. And this also helps us with the switching of medication, because everyone is different. So one medication might work for someone and then the other one might work for somebody else. So we have ways of monitoring it, but AIDS will be more at the end stage of the disease.
Okay.
So for people that might get those diagnoses, what's the next step for them?
So let's talk about the testing first. So when you're getting tested for HIV, we counsel you on, basically what we're doing, what HIV is. Of course, we always tell the patients that it is treatable and you have support afterwards. You get the test done, and, unfortunately, if it's positive, you're going to get counseling afterwards too.
Okay.
We would do a confirmatory test just to make sure, we always confirm HIV tests. Well, any test, but we also confirm HIV tests to make sure, that you are in fact positive. After you get it done, then we run some blood tests, we run the viral load, and then you're started on treatment.
And what does the treatment look like?
Usually it might just be one pill a day. It might be a combination of pills, but it's a daily treatment. And when you get the treatment, you're monitored at specific intervals. Regrettably, if you are diagnosed with HIV, our main goal is to get you to a stage of being undetectable. So basically what that means is, you're on treatment, you're getting monitored. And when we check you for the HIV, if you do a random test, it comes back negative. Because when you're undetectable, it's untransmissible. So that is how we can get to stopping the pandemic of HIV.
Okay.
Testing, if it's negative, great. You continue testing and protection. And if you're positive, you get treated until you become undetectable and untransmissible, and then it stops there.
So for anybody worried about not having relationships after they find out that they're positive, then there's still some hope for them.
Yeah, there still is hope. What I would say is, just be honest. Be honest and disclose your status. That is something you should do. Disclose your status. Make sure you're being treated. And it's possible to have a relationship. Your partner can even go on PrEP. And it can work out. You can even have children. It's not impossible. And people do it all over the world. But you need to make the first step to go and get treated if you're positive. Is you don't have to stay home and think your life is over. We have the technology for you to have a long life, to have practically the same life expectancy as anyone else once you're treated correctly.
Yeah, that's good. I've actually heard some very positive stories about persons who have had a positive HIV test and have gotten themselves to that point where U equals U, as Amy just said, where they're undetectable and therefore untransmissible. So and they're living very wonderful lives. They have kids, So you do hear those stories all the time of persons who did the right things. They went and they got tested. They got some very shocking news at the time, but then they went and they got treatment, and now they're living very full lives. So. Yeah.
One of my favorite people, one of you guys from Queer Eye.
Yeah. See, so it's not a death sentence like I used to think. But I think that's the good thing about these things. That's the good thing about education, about having conversations about them. Because then we can talk about it, And you can always go talk to your doctor. I think there are other counselors out there that you can go reach out and talk to.
Yes.
About these types of things. Yes. So it's always good to talk about it and make sure you go get tested.
The real problem is the stigma. Once we get past the stigma, because that stigma stops most people from going to get tested. And once we don't get tested and we're still having intercourse, that's where the problem lies. Because the whole point is to end HIV once and for all. So once everyone is doing their part, we can get there.
Yeah.
Even if you become infected, is not the end. Is not the end of the world. You can get treated. You can get counseling, because of course it's not going to be, something that most people would take lightly. It would be traumatic.
Yeah.
But we have people that can help you to get through it. And once you get treated and you become undetectable and untransmissible, then you can have a normal life again.
That's really good to know. Okay, so are there any takeaway points for our viewers other than the time to get tested is now?
Okay, so other than that, if you remember anything from like just one thing, remember LTMMR. That is a long-term mutually monogamous, meaning both of you are only having sexual contact with each other.
Glad you stressed that.
Yes, LTMMR. Also, get tested. Also, protect yourself. Also, go and get tested and get treated. And be honest with your partners.
I like that. All right, guys. So now that we're wrapping up, we would really like to say a big and special thank you to Dr. Danielle from Go Medic. We would love, love, love to have you back anytime. Jerri and I are definitely gonna go get tested. Because even though we are in LTMMR,
she loves this, guys.
I know. I'm telling you, a little pendant I'm gonna have soon. It's always good to get tested and to know your status. And I think out of all the things, know your status. Let's be honest. Let's get tested. Let's get treated. And let's love ourselves.
Yeah, the sooner you find out, the sooner you can deal with it.
Exactly. So again, thank you so much, Dr. Danielle from Go Medic. Whenever you're ready, give us a call. We'll have you back. We have so many different things that we would love to talk to you about.
All of the questions we have for her.
All of them.
It was my pleasure to be here.
Thank you
thanks
so
for having
much.
me too. Because this is important information that I want the entire country and world to see.
Yeah. Agreed.
Thank you for everyone that joined us this episode. And thank you so much to our guest, Dr. Danielle Reid-Melillo. We got it right this time.
Hey.
And we are now officially 2 bottles in.
So this is actually officially our last episode for 2021. We are going to pick back up the first week in January in 2022. So we're going to see you then. However, we are not going to leave you all high and dry because that's not us. What you can be expecting from us within the upcoming weeks is a new little excerpt called Quick Shots. Now, if you're like me, you want to know what quick shots are. Quick shots are short format content. Some of the content will be taken out from our conversations.
Yeah.
Some things that didn't quite fit.
Some of them get quite heated.
Some of them get quite heated. Some of them will be conversations we had with some of our guests.
Yeah.
We would also be doing little excerpts here and there, some fresh new content that you will see. But as I said, we won't leave you high and dry. We're definitely going to put some quick shots out for you between now and the first week of January. And then we'll be back then. We'll be back with you so we can continue to get 2 drinks in with you. We hope you subscribe. We hope you like the videos, watch, and share with your friends and family. Merry Christmas.
Thank you for watching.
New Year's. And yes, thank you for watching.
And give them what Russell usually tells us to do.
Yes, and you need to smash that like button, click subscribe, and hit on that notification bell. We would like to thank again Dr. Danielle Reid-Melillo. Oh, 2 bottles.
I wasn't looking anywhere just now. I was like...
You were not trying.
It was bad.
Okay. We would like to thank Dr.
Not me looking at any titties when he said head. I'm fixing them.
Boobies. Sorry, it's the alcohol after.
I'm here like, from me? Okay. Right, guys. Thanks for everyone that joined us. And our, what do we call her though?
Our guest, Dr. Danielle Reid-Melillo of GoMedic.
Reid-Melillo.
All the girly.
We should have done this before the multiple bottles of alcohol, Amory.